All right, March is Colorectal Cancer Awareness Month. We're joined right now in the studio by Emily Kuchinsky, certified genetic counselor with the MedStar Health Network. Thanks so much for coming in.
Thanks so much for having me.
So talk to us about, this is something that you can hear it, talking about colon cancer.
Yeah, so the majority of colon cancer is sporadic. It's due to a combination of just the aging process, things we're exposed to in the environment, and also lifestyle factors like smoking and obesity. However, about 5 to 10% of colon cancer is inherited, and we would expect to see certain red flags in that person's family history. So number one, seeing colon cancer diagnosed at a young age, so usually before the age of 50, seeing colon cancer in multiple generations, and also seeing rare cancers like pancreatic or ovarian cancer. And when we think about genetic testing, we want to start with someone who has cancer. They would be the most informative relative to test. And then we can test the rest of the family if we find a genetic mutation in that relative with cancer.
You know, some of the gastroenterologists that we've had on today so far said that they're seeing more and more younger cases. Talk to us about the importance of, I guess, finding out if you have it hereditary in your family.
Yeah, so it is scary to know that you're at this high risk for cancer, but colon cancer is actually one of the most preventable cancers because of the effectiveness of colonoscopy. So for our high risk individuals, we start colonoscopies earlier and do them more frequently. So for example, with Lynch syndrome, which is one of the most common causes of inherited colon cancer, those individuals have up to an 80% risk to get colon cancer because of that mutation. However, if they start colonoscopies at 25 and repeat them every 1 to 2 years, their colon cancer risk can go below 10%. Okay. And also knowing about these mutations, sometimes it's not just colon cancer. It can be other types of cancer like uterine or ovarian cancer. So we might recommend to a woman when she's done having kids to have her uterus and ovaries removed. So it can be really important to understand, you know, what mutation may be in the family and what are the cancer risks that are associated with it.
So you do the genetic testing, you find that you're at a higher risk for it. So then what do you do next?
Yeah, so at MedStar, we actually have a high risk assessment and cancer prevention program. And so we follow individuals who are at high risk, and we develop a personalized cancer screening and surveillance plan. And this really provides them with concrete steps that they can take to lower their risk for cancer or possibly even prevent cancer. So knowledge is really power with this, and it gives people a control of their situation. Even though they have that high risk, they feel like I'm in control and I know what to do and be proactive.
All right, Emily Kuchinsky, certified genetic counselor with the MedStar Health Networks. Thank you so much. Just one of our many experts here.
Love it.
Others in the studio, the number to call is 410-671-0702. They're going to be taking your calls until 6:30 tonight. So Jamie, I'm going to send it right back to you.
Telling him she should have her own show. Emily?